So when we see a lot of low back patients in the office, the root cause of the problem is usually a disc issue. So the thing that's actually causing the pain is coming from the disc, which is, as you can see here on this model, is the shock absorber in between the two vertebrae. So when this disc is nice and healthy and full, it works as a really good shock absorber on the spine. So when you have gravity weighing down on you, this is what keeps it from being bone on bone. So when these are nice and full, the hole that the nerve comes out of, it also is nice and full. So when you have that ability to have a lot of room for the nerve, then the nerve isn't getting pressed, it's nice and healthy, it's able to transmit that information from your brain out to your body and from your body back to your brain. What happens though is as people age, as they have micro traumas or bigger traumas, they start to have issues in the disc where it can actually start, the nucleus of the disc can actually start to move towards the outside. When that moves towards the outside, it can actually start to bulge back into the nerve. When it bulges back into the nerve, that's when you start to feel pain. So whenever you feel pain in your body, it's always because some nerve is being pressed in some way. So along your spine, these spinal nerves are what really create a lot of the problems that we deal with when people show up to our office with neck or back pain. So when this bulges back, it presses that nerve, that creates the inflammation and the pain, and that's usually what sends someone in. So if you do have a disc issue, in our office we look at three things. We look at the spine, we look at the alignment and the motion of it, we look at the disc health, and we look at the muscles that attach to the spine. So this table here that Blair is on, she is doing spinal decompression, which allows us to start to stretch that spine slowly, then bring it back together. Stretch it slowly, bring it back together. So underneath, you can see here, the table's actually opened up here. So it's in full stretch right now. In about 30 more seconds, it'll start to relax. This table will start to come back together. And because it's pulling here at her waist, what that's doing is it's creating a negative pressure within this disc. So when it creates that negative pressure, it creates a vacuum, and it starts to pull. If there is a disc bulge going on in one of the discs, it'll actually start to pull that back away from the nerve. That gives a relaxing of the pressure on the nerve, and then that allows you to start to feel better, the inflammation to go away. We do other things to try to help speed up that healing process. But the first thing that we have to do whenever there's a hot disc issue or a bulge or a rupture is we have to try to get that pressure away from the nerve as quickly as possible. So in our office, we're going to be doing decompression, we're going to be doing the adjustment, and we're also going to be doing some modalities to help decrease that inflammation and help speed up that healing. So if you're dealing with any kind of low back pain and you want to find out if it is it's a disc issue, the first thing you need to do is talk to a chiropractor and get a full exam and find out if it's something that we can help with. But if if you're dealing with this now and you found some value out of this video, just make sure you like, comment, or share below, and we'll see you on the next video.